Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Okay, we are starting the Auburn Medical Group live stream here on Monday afternoon with Dr. Gawain and Dr. Mark Vaughn.
Hello.
So you can see who we are, see our socials. Thank you for coming, Dr. Gawain.
Just barely made it in time.
And myself too, because I've been off and on with trips keeping me out on Mondays. I apologize.
That's right. Yeah.
But here we are with a show on a Monday, and thank you for being a part of it. We are going to be talking about telemedicine, which you might have some questions about. And of course, this is a live program with a chat, so you can ask your questions. I would like to note that we did have a comment prior to the start of the show. You can actually put your comments in as soon as I put up the placeholder on YouTube. You can actually put in comments, and Bianca did. And some of you have been watching the show, and she's been commenting. Oftentimes, we've had subjects that have to do with her mom, who died on the 13th.
Oh, I'm sorry to hear that.
She is acutely in grief right now. So we want to remember her. One of our people that's on Patreon and very much a part of the show and participates in the chat regularly. And so it affects all of us who have been getting to know her. So, Bianca, we are all wishing that this didn't have to happen and that you could get through this quickly. And we know that you're going to go through grief. We could here before we get talking about what we're talking
online.
About. Yeah, the online doctor. We could just talk briefly that the grief. We have patients who go through grief, and they sometimes want to have it medicated. Well, we actually have studies showing that when grief is medicated, it usually is worse, and people have more of a hard time adjusting.
Prolonged
prolonged or abnormal. So medication is kind of safe for those extreme cases. It's supposed to hurt when we lose a loved one. It's something that we have to experience with the way our bodies and minds work. So It does represent, though, I will say, the pain of normal grief represents something that had been good.
Right. Yeah. Losing something.
So, there was a great good for there to be great grief. Okay, Bianca, she's there right now. Mm-hmm. Thank you, means a lot. I think grief needs to play out to help get past it. Yeah, so true. And we're sorry for what you're experiencing right now. The subject of telemedicine. Telemedicine.
We do telemedicine.
We do telemedicine. So we started doing telemedicine. We may have had it in place right before COVID, if I remember correctly.
Yeah, that's kind of when it ramped up, though.
We have a service that is that we use in our office that's very affordable and is HIPAA approved.
Yes.
And we're able to have patients click on our website for whichever provider they have the appointment with. They enter their name, they give their computer or iPhone or whatever kind of mobile phone permission to use their microphone and the camera, and then we can see them. We can have two-way communication with sound and with video. And it surprised me how useful it was. We're taught the importance of physical examination, and when we train, and what we realize is, wow, a huge part of physical examination is just looking and seeing how the patient moves, how they speak, hearing the sound of their voice, hearing their breathing, seeing their breathing, how they sit. Mm-hmm. Yeah. And it's surprising how much that informs our decision-making.
Oh, absolutely.
So I thought, it's only going to work for a few things. Oh my goodness, I'm surprised at how much it can work for. How much of what we do day in and day out does not require putting a stethoscope on or touching, which goes against kind of one of our values here, and that's human touch. We do have a place where patients come in And we do physical exam. We touch them. So we'll talk a little bit about how that relates to telemedicine. Bianca also says her cause of death was written as heart failure and pneumonia. Then secondarily was cirrhosis and diabetes. Oh man.
Yeah. Wow.
That's a lot for a body, even a healthier young body that doesn't already have health problems to deal with those insults to the body. And then when you're older and you've had chronic disease for a while, that's hard to come back from. So
Right.
Still, many patients are dying from these very problems. Pneumonia, I do feel I have to say, if there's any viewers out there who are eligible for the pneumonia shot and haven't received it, we strongly encourage getting the pneumonia vaccine. The one that we choose to use in our office is called the 20. There's 4 or 5 of them. And the 20 kind of hits all the boxes for what you'd want a pneumonia shot for. And there's a new recommendation for people down to the age of 50 years old to get. I need to get it. Wow. I'm old enough to have to get one of those old people vaccines.
One of those old people vaccines.
Oh my goodness. And then Bianca also says her kidneys weren't fully functioning either, and she had edema. That often happens.
Gosh.
So, to take, for example, what her mom was going through toward the end with all of those things, if you're able to talk with the family member, able to see on video, and able to have lab test results, which requires going to the lab.
Very helpful.
You can actually do quite a bit of the evaluation. I'd still want to be able to listen to lung sounds in a patient with the problems that her mom had.
Now, I want to approach this. All of our telemedicine visits are with patients we know. It's not just first time ever seeing somebody. We have seen them before in the office.
Yes.
We know what quote unquote normal is for them.
Yes.
So that is an important thing to note when you're doing a telemedicine visit. Because you can tell a lot about somebody that you've been following for years and years. So
there's some things that lead to problems in medicine, and one of them is not being familiar with the patient.
Oh, absolutely.
Which is always a risk of people who just pop into the urgent care. And if you don't have any chronic illnesses and there's nothing wrong with you, that's probably not an issue.
Right.
But patients who have chronic medical problems, they really should have a home. Like a primary care office for what's going on. Telemedicine for us is an adjunct to inpatient visits.
In person, not inpatient.
Or in the office. Should I take a call from our PA? If you can carry the show, I'll take
carry
a call.
the show.
Yeah, if you can.
Always on my shoulders.
Okay. Yeah, always on your shoulders. Okay.
Yeah. So part of that. We're talking about online visits. So with online visits or MHO visits, I'm going to move over to the middle so you see more of me. They're with our patients, so that helps when we see them. Another way that we do online visits is asynchronous visits. That is a little different than those video visits where it's kind of like almost like, well, you can see me, I can't see you, but where it's like back and forth video, where it's in time. You guys can respond while I'm talking here, but you can talk back and forth. That's a synchronous visit, which is pretty much like a normal visit. But there are also asynchronous visits where our patients can say they have a complaint and we send them a questionnaire or ask them more about it. They send it back to us, and this can all be done kind of throughout our days as providers. And I just had one today that was it was a lady who had a pretty bad rash, which she attributed to coming in contact with poison oak. And she was able to send pictures through our secure online chat. I was able to look at those pictures in between patients, say, oh yeah, that's poison oak. And I sent in a prescription to help her out with that. So that's another way to do it, which actually lends itself really well to things that don't need this kind of one-on-one back and forth. So we do that for UTIs often, where we need to order it, urine test or antibiotics if we know them. rashes, skin stuff. We can do upload pictures. I think a lot of the healthcare systems these days have similar type systems where they can upload pictures and do that sort of thing. I know I'm not doing the chat, but so I'm going to try to do these things. Oh, Rusty's here. I don't know how to do this. There's a button I'm supposed to push. But anyways, Rusty's here. Hello. He says hi. He says hit the thumbs up. Appreciate it. And Bianca's responding as well. We do appreciate. Prayers for her mom. So online visits can be very helpful, and they're a great adjunct to what we're doing. I know of some doctors that their primary practice is online interactions. Psychiatrists do this often. Often for psychiatry, you don't really need to do a physical exam where you need to, listen to some longs or anything. Most of your evaluation is just by the way the patient is talking and interacting. So psychiatrists will often have a video visit only practice where they just work from home. And it works out well for them. So that's one area where it can be very helpful. Oh, you're back.
Yeah. So
good, because I was flailing.
Yeah.
No, just kidding. Talked a little bit about asynchronous visits.
Oh yeah.
And how those work. I'll give an example of one I had today. I didn't know how to bring that up on the screen, but Rusty.
Yeah, you just click on it. So Rusty also says.
Oh, there we go.
Please hit the thumbs up on the video. Oh, yes, thank you, Rusty. We appreciate that. Bianca was a lot of blessing for her to let you go.
Yeah.
Out of pain. Yeah. I'm sorry. Go ahead.
Yeah. So that's kind of where I was at. I was saying some practices lend themselves psychiatry. They can often have their almost majority of their practice be online. So that's kind of where I was looking at.
Even psychiatry, because of the effect of some of their medicines, they should probably do an initial heart exam.
Probably. For some, or if you're doing some of those antipsychotics
or have access to records of physicians who have.
Sure.
Maybe.
Sure, I can understand that.
So the reason this came up as a topic is because we actually are seeing patients who have us as their doctors self-referring online for certain things.
Right. So this came up this morning, and actually that's why I brought it up, that, hey, maybe we should talk about this. I was seeing a young gentleman in his 40s who has me as his primary care, sees me once a year, pretty healthy, actually very healthy, and just mentioned kind of offhandedly, he's like, oh, I did taking this one medication that was prescribed to me. I was like, well, how did we get that? And he said he was doing one of those online visits. I forget the name of this one, but online telemedicine, some sort of thing where they were prescribing something to boost his testosterone, which always is just a little alarms in the back of my head, kind of sets off things. So I was like, well, that's interesting. Especially for testosterone, where there are actually pretty specific guidelines on when to treat testosterone and when to even look for it.
There actually are people that need that.
What's appropriate to even check? Yeah, to even check for it. So if you have not heard some of the commercials for these things, I don't know where you're living or what podcast you're listening to, but they're on just about all the ones
they're not on the podcasts I listen to, and they're not on the streaming shows I watch.
Oh, well, they come up for me. Maybe just because I'm in that age group of a 40-year-old male. 40-something. Sorry.
And they wouldn't try to target a guy in his 50s?
I would think you'd be, yeah. But you probably heard of some of these. I would probably say their names to get in trouble. But
okay, there's some of them out there.
I don't know if we should out them. But a lot of them cater to a lot of the, what would you call it, lifestyle medicine, or like things that...
Like vending machine candy store?
Maybe that's a way to put it. Like, what are you went through one of their things today, and what were the list of things that they treat? Testosterone, like fatigue, general hair loss.
Yeah, hair loss. Okay, hair loss.
Erectile dysfunction.
Yeah.
That's a common one.
And along with that, the whole selling of testosterone, and I'm guessing whoever manufactures testosterone is behind it.
Possibly.
Making it in a medicinal form, big pharma. Just a guess. but there's this whole he-man, toxic masculinity movement out there, and it includes making men feel less than what they should be if they don't have, muscles showing through their clothing, if they, comments about their sexual performance or activity, hair, balding, energy level.
Yeah.
And all in an effort to get customers to buy testosterone. And here's the funny thing. You found out that this product wasn't the actual product. It was an isomer of it.
Yeah.
Meaning similar chemically, but not exactly the same.
It was.
And compounded.
Compounded, right. Which some compounded medications we're always a little wary of.
We talked about this recently. About a month ago, I think.
That's right. Yeah, we have somewhere. Look it up. We were talking about that.
But he's got a doctor who can address real problems.
Yeah.
If he's got the symptoms that go along with a real testosterone problem that needs to be treated, and then here's the other thing. We know that the studies show that when you give a placebo, you get the same response in men that don't have a true testosterone deficiency.
Yeah.
It's all up here.
A lot of it is. A lot of it is psychological.
So that's why if somebody doesn't really have signs of having a real problem, we don't try to push them down this road of testosterone. Also, real testosterone, we know if you're really getting the real thing,
risky. It's
potent. There's things. First of all, if anybody is giving some kind of an oral agent and they're saying it's testosterone, run the other way as fast as you can. If it's real testosterone, you can't in the United States legally get it to take orally because it causes
cancer risk.
So when you eat something, when you take something by mouth, it goes to the stomach and the intestines and gets absorbed, and immediately that blood supply that it gets absorbed into goes straight to the liver, does not go anywhere else first, goes right to the liver. And so testosterone taken orally, you only get a third or a quarter of it, or maybe
pretty
possibly
low.
even less once it gets out of the liver and goes to the rest of the circulation by way of the heart. And it causes liver cancer. So
it's a real risk.
The risk is so high, it's not even, it's against the law in the United States. So how do you get it? Well, you have to get it into the circulation without going through the liver. So that's injection,
topical or
yucky, sticky, pasty gel that I don't understand this, but apparently that stickiness, that mess is so bad that every patient I have who gets supplemental testosterone comes in for an injection every 2 weeks.
That's in some insurance things too. As far as coverage, there's I think some issues.
I didn't account for that.
Yeah, that's all right. I think so. There is a growing movement for this, for lack of a better term, lifestyle medicine, which is being very, very gracious to it. Grifter is probably a better word. But things that people say, oh, your doctor can't take care of this. This is something that's above and beyond. Well, the reason we won't take care of it is because it's not appropriate. We treat people with true testosterone deficiencies. We know how to check for it, which truly should be checked twice, early in the morning, to make sure you get a true value. And it's got to be confirmed. And then you've got to make sure their risk is not high. So in my case, I typically will check their cholesterol to make sure it's not out of range because testosterone will increase that. We'll check a PSA to make sure they're not at risk for prostate cancer or have any small prostate cancer that the testosterone is just going to explode.
Right. Testosterone
there are risks and there are things to account for that I'm not sure all of these companies are accounting for.
Yeah, I looked online to see if the California State Board is investigating these telemedicine only, lifestyle, and they're looking into them. They're keeping a very close eye on it to try to protect people who might be just going to them because they saw a commercial and it sounded like, oh yeah, I'd like to have that.
That's me.
Yeah,
I feel a little tired on the weekend.
a little tired.
Because testosterone will help out with that, but the risk is not worth the benefit.
I don't feel like my love life is what's portrayed in movies. Therefore, I'm abnormal.
Or the pornography.
Or that. Yeah.
I don't feel like I did 20 years ago when you were 20 years younger and had a lot of other things different in your body, not just testosterone levels.
Yeah, it's pretty shown that a man in his 50s to 70s shouldn't have the testosterone level and activity and effects of somebody in their 20s. That's not a healthy life. Okay, so no new comments over here. The good side of telemedicine, we kind of talked about that earlier, that we are able to use it.
Yeah, it allows access.
So it's very useful with your primary care doctor you already have. It's very useful when you live in a rural place and you can't get to a specialist without driving halfway across the state. Then there's a place for telemedicine for that. Mm-hmm. But these private companies that are owned by, venture capitalists.
Yep.
That now, somebody could point out, well, in California, venture capitalists can't legally own a medical practice.
Right.
Yeah, they get around it.
They do.
We know because we see other people, doctors that are independent like ourselves, getting letters from them, trying to come up with ways to keep them on the board or whatever,
right,
in order to keep it supposedly physician owned. But there's investors who aren't physicians necessarily, and they have a way of figuring out how to make it look appropriate, but there's still the profit pressure. And of course we want a profit too. We're in business, we have to stay open, and we like to make some money and have retirement too. But we also are in the room one-on-one with the patients and genuinely care about them. Yeah. At least that's what they tell me I look like.
Jeez. Wow.
Yeah.
Yeah.
All right. Other comments or questions from you? Or Dr. Wayne, did you have anything else you wanted to add about that?
No, I would just say be cautious. Please make sure you have an actual primary care physician. Please. And I would run, if you're doing anything, these things, run by them.
Yeah.
Another one that's common these days are GLP-1s, like Ozempic type.
We actually
things
did a show on that, yeah.
That are kind of
GLP-1s that aren't FDA controlled and
right, that are compounded. That's I think where we got
compounded. Oh my goodness.
So yeah, I mean it's just one of those where, having a doctor who knows you well, it's worth discussing all of the risks with that doctor. Truly, we don't. It's not because we're not trying to make you feel well, or we're trying to keep some.
We're not trying to make them feel well?
It's not because we're not. It's not because we're not.
Oh, all right. Double negative.
Double negative.
Doesn't make it right.
Yeah. Double negative.
Two double negatives don't make it right.
Well, yeah. We just are aware of risks, and we know things that are appropriate. And
take seriously the responsibility of knowing the patient.
Right.
So there you go. A little push for primary care.
As always. Keep watching. Thank you for watching.
Thank you, Lindsay Antwine. She's a great help. I can show you again the Patreon so that you can see. It's down at the bottom blue thing there going across for if you want to be a part of that. And until next time.
Hey, I'm Dr. Wayne Baugh.
Dr. Mark Baugh telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.